Windkessel vessels, that is, distensible vessels. These vessels are highly elastic. Windkessel means elastic reservoir. For example, aorta, pulmonary artery, and their larger branches. Resistance vessels, they contain less elastic tissue but more smooth muscles. They can change the diameter by contraction or relaxation of the smooth muscles. This changes the resistance and thus influences flow through these vessels. So these vessels are also called as resistance vessels. For example, arterioles, meta-arterioles, and precapillary sphincters. Capacitance vessels are thin-walled and highly distensible, so they have the ability to store large amount of blood and hence called capacitance vessels, for example veins. Exchange vessels are the thin-walled and have fenestration and help in the exchange of materials between blood and interstitial fluid, for example capillaries. Shunt or thoroughfare vessels are the bypass capillaries, for example arteriovenous anastomosis. Windkessel effect. As the heart contracts intermittently, the pressure and blood flow in the large arteries is pulsatile. That is, during systole, volume of the blood is pumped maximum, and in diastole, it is minimal. However, the flow of blood through the blood vessels is continuous. It is because of the behavioral pattern of aorta and other large vessels. During ventricular systole, the blood enters the large arteries with considerable force, and this blood can be accommodated by distensible nature of the blood vessels. During diastole, force is absent and the volume of the blood entering vessels is zero. But since vessels recoil due to the elastic property, the blood pressure is retained and the blood is pumped to the periphery. This recoil effect is called as Windkessel effect, and the vessels exerting this effect are called as Windkessel vessels. For example, aorta, pulmonary artery, and their large branches. So this is the mechanism by which uh, the Windkessel effect acts. When blood flows into the artery, it is going to create the pressure, and because of the elasticity, they are going to tend to distend, and when they recoil, they are going to push the blood in a forward direction, and this is called as